More than 6 million Americans, most of them over the age of 65, are believed to have Alzheimer's disease. November, by the way, is Alzheimer's Disease Awareness Month.
The disease is currently ranked as the 7th leading cause of death in the U.S. and is the most common cause of dementia in older adults. So we are joined right now by Dr. Ira Chang, a neurologist with the Swedish Neuro Network. Doctor, thanks so much for joining us today.
Thank you for having me to raise awareness for Alzheimer's dementia. As you know, more than 6 million Americans have been estimated to have it.
Yeah. We appreciate you being here. First off, what are some of the warning signs of Alzheimer's disease, and just what should people be aware of?
Yeah. So that's actually one of the things that can be under-recognized and can take a long time to recognize, because long-term memory is usually not as affected, and so sometimes people may not know about or recognize progression until there's a decompensating event, such as like moving out of your normal home, getting in a car accident, maybe going into the hospital, having a caregiver go out of town, and then all of a sudden the symptoms, which are primarily short-term memory loss, visual spatial dysfunction, and maybe like complex decision making, which a lot of elderly people might not really need to do unless they're in those situations that it comes to light and people understand, family and friends understand something is going on.
Are there any ways to slow progression of the illness once the symptoms start?
Sure. So I think one thing is it's very important to recognize and diagnose Alzheimer's dementia, because it is a form of dementia, but there are other common forms such as vascular dementia, which can be caused by multiple little strokes. But diagnosis is certainly important to rule out tumors, B12 deficiency, and the strokes. And then once it's diagnosed, there are lifestyle changes as well as medications. One of the most common things that's recommended recently is vitamin E. 2,000 units, high dose, very little in the way of side effects and costs, but a couple of studies have shown perhaps some slowing of functional decline. There are medications that are available for treatment of, once it's diagnosed for Alzheimer's disease. And now, in the past year, there's been an injectable drug that might reduce the buildup of plaques in the brain that are associated with Alzheimer's.
And Doctor, we only have about 30 seconds left, but when should start people being aware of their cognitive health? Is there an age threshold for something like this?
There is not an age threshold, but there are a lot of risk factors that are associated with Alzheimer's dementia, such as inactivity, social isolation, chronic sleep deprivation, and vascular risk factors. So I do think one of the things that people can do at any age is to eat a healthy diet, have a healthy lifestyle, interact with others, and do all these sort of things that can help maybe prevent as well as slow progression.
All right. Well, Doctor, thank you so much for joining us.
Thank you very much.
Yes.
Thank you.
All very important information.
Yeah, and you could watch this interview and all of our health interviews on our website, cbscolorado.com.